A lot of my patients are asking me zirconia implants versus titanium implants. Now, guys, I am an implant specialist. There are not a lot of implant specialists out there, by the way. There's just a few of us. There's a lot of people that dabble in implants, but there's very few of us that have the skill and the experience to call ourselves implant specialists and the credentials. So this is the authoritative video today on zirconia versus titanium implants. Hey guys, Dr. Heath Lampee here again for Teeth in 24. Now, for the last 20 years, I have been placing implants, and 99.9% of the implants I placed have been titanium. The other 0.1% have been the zirconia implants. Now, why is that? Is it because titanium is better than zirconia? Is it because we've been using titanium longer as well? What's the deal? Now, if we go back with original implant research from the 1970s and 80s with dental implants, they've always used titanium. Now, when we talk about orthopedic surgery, we're talking knees, hips, shoulders. Orthopedic surgeons are using the vast majority, pretty much titanium implants. And the reason is titanium is very biocompatible, and also the bone latches and fuses onto it quite well, and it can last a very long time in the body without a foreign body response. Now, I know some people say zirconia is biocompatible too, maybe there's less of a response. Now, in my history of placing thousands of titanium implants, there is no inflammatory response to implants. There's no rejection. They work. They're tried and true. The research is done. Zirconia dental implants are a little different story because, you know, they've been out maybe 5-10 years. There's a few different manufacturers that make them. They're more of a very kind of odd specialty boutique-y item, and you know, I want to be able to offer my patients, you know, the best. And some of my patients are like, don't put titanium in my body, only put zirconia. And for those patients, I have done zirconia implants. Now, what I'll do right now, I'm going to do a little unboxing. Who doesn't love a little unboxing video? I'm going to open a zirconia implant. This is Nobel Biocare. They call it Nobel Pearl. And these are the zirconia implants that I've opened. And, you know, it's kind of fun unboxing one of these because it comes in a little, is that an egg or an eyeball? Who knows? It's kind of weird, right? Let's see if I can get this open. Let's see here. Okay. Oh, I like this. Okay. So there's always stickers in here. Everything is sterile. And that's finally what I get open. So this is a 4.2 by 12 millimeter Nobel Pearl tapered implants. And let's see here. Oh, gosh, there's even more packaging in here, guys. It's wild. Okay, there we go. Okay. So an implant is basically a tooth root, guys. So this is the zirconia implant. Now here's the thing about this. Zirconia, when it's in bulk and bigger, now this is a tiny piece of zirconia. It's also hollow in the inside. So this is a tooth root, kind of small. Now zirconia, these are very technique sensitive to put in. If your bone is a little too dense, if I torque this in a little too much, there's a chance that some of these threads can break off, the implant can break, or if you chew on it too hard, that you can actually fracture the implant. Now, because these are slightly more fragile and more technique sensitive to put in, it doesn't make a lot of sense when we have more research on titanium, and titanium in smaller amounts like this is actually going to be much stronger than the zirconia. So why don't we open a titanium implant? You know, let's do it, okay? This is also Nobel Biocare. This is a Nobel Replace implant, 4.3 by 16 millimeters long, a nice big long implant. And so, you know, we got all the packaging, guys. Everything's sterile here. You know, we haven't put it through the dishwasher. So here we go. One more. Okay. This is show and tell. It's like third grade all over again. This is stuff I love. It's very fun. Okay. So this is a titanium implant. 4.3 millimeters wide, 16 millimeters long, very strong medical grade titanium, the same titanium they're going to use hips and knees. This is what I put thousands and thousands of these in with no issues. Very predictable. I put these in young people, old people, soft bone, dense bone, people with autoimmune disorders, people with diabetes. I even put it in smokers and they do really, really well. And so this is much stronger, less technique sensitive, less liable to break while we're putting it in the mouth, less likely for you to break it in the mouth. And so if I were to say titanium versus zirconia, I've got experience in both. The titanium is going to win every day in my practice, and it's going to be in your mouth a heck of a lot longer with fewer issues. Now let's talk about in implants where zirconia is better than titanium. And that's when we can actually make it in a larger, bulkier sort of material. And that's where we have our full mouth teeth and 24 zirconia teeth. This is a full piece of zirconia. This actually comes from like a hockey puck size piece of zirconia. And my CAD/CAM mills will mill this out, and we actually will put this into sintering ovens for over 12 hours to make it super strong, super durable. This I can put in your mouth and I know it's going to last a lifetime. And basically, I will screw this in the mouth on 4 or 6 of these titanium implants. So what's crazy is like the implants that are in the bone, that are underneath the gum line, they're titanium. But what I put on top of the titanium implants is zirconia ceramic. And I know it's going to last. And the proof is in the pudding. These do not break. They are so biocompatible. Patients with all sorts of weird allergies, nickel, other things like that, they have no issues with this zirconia or the titanium, and it's going to last a lifetime. Now, we do not do zirconia implants on zirconia teeth. That is a recipe for fracture, for failure, and an unnecessary complexity that is not going to last the rest of your life. So remember that titanium is going to be better for the actual implants in your jaw. Zirconia teeth can go on top of that. That's totally fine. It's because zirconia has to be a little bit bulky for strength, and that's what you get right here. So thanks, guys.